Welcome everyone to Social Impact Live. I'm your host, Richard Hara, and this program is, as you know, a weekly conversation with members of the Columbia School of Social Work community. I'm pleased to have here today, virtually, Ovita Williams, who's an Associate Director of Field Education at the Columbia School of Social Work, also a PhD candidate, right, at the Hunter Silberman School of Social Welfare. So
exactly.
Yeah, I want to put that in there as well.
Thank you.
I don't know where exactly to begin. I mean, we're in the middle of it, right? And I know originally I wanted you to come here today to talk about your involvement with this new third edition of what's basically regarded as the Bible, right, of field instruction. It's used to teach field instructors how to do supervision of students and so on, called Learning to Teach, Teaching to Learn. Is that correct?
Yes, Learning to Teach, Teaching to Learn, a guide for social work field education.
Okay, and I'm sure that we're going to have an opportunity to talk about how it's now, I guess, evolving in response to so many changes that we're experiencing in our lives, in our practice, and so on. So,
for sure.
And generally just think about what is happening with social work education. I know field education is regarded as the signature pedagogy of our profession, of our discipline, and so on. And trying to think about exactly, what we need to do to make it relevant to 21st century practice, right? To sort of move forward with our social work practice and also with social work education. So again, welcome to the program, and let's just start out with your thoughts about where are we with all of this?
Well, day by day. I mean, I really appreciate the opportunity. Being a field educator for the last 25 years, I've definitely seen where social work has been at the forefront of many types of crises. So I really appreciate the opportunity to talk about how field is responding, and how, as field educators, whether you're a social worker in an agency, you are a practicing student, you are a clinician, you are a policymaker, we are responding and have always been at the forefront. And this is something that we never expected, but we're always responding to crisis. So it seems quite natural that we would try to determine what that now looks like. I want to just take a moment and recognize that there are hundreds of people online, and we're all in different spaces of mind, body, soul. And a lot of really sitting in this in crisis work is starting with ourselves. So if we could just take a minute and sort of think about reflecting, breathing, being mindful, and checking in with what's coming up for us. What are our feelings? What are our thoughts? Then we can really step into all of what we don't know right now. So just a moment, if you could just, for a moment, Richard, just, I want to ask folks to think about right now, in the past few weeks, what has been one thing that has been positive, unexpected, an experience you've had that you want to just hold. I'm not going to have in this format time to share, but jot it down, write it down. What's come up for you? What have you learned? What have you gained? Because I think once we unpackage that for ourselves, then we can do it for our students, our colleagues, and the community members that we serve. So just sort of sitting in that for a moment. So it is an opportunity. I think it's an opportunity for empathy, for inclusion during these times, an opportunity to capture where we have our strengths and resiliency in the profession, and also learning from people that we serve as field educators, as social workers and practitioners. So it's a hard time. Every day is coming moment by moment with changes, with ideas that we had about social work, ideas that we thought we knew about what field education should look like, is now asking us to dig deeper.
Yeah.
To really dig deeper.
And I think, you know, maybe it starts with just examining or just, is field education, right, something separate from social work service, right? Our connection, our everyday influence, right, in the lives of the clients that we're privileged to work with, I think is, I mean, you know, sort of seeing it simply as education is a problem.
Yeah, I think what I've always said, and I think many of my colleagues, field being the signature pedagogy, and I just really want to acknowledge my colleagues that I wrote this book with and co-authored with, Dr. Cheryl Frank, Dr. Jean Bertrand Finch, and Dean Jackie Montrose. When we decided to sit and look at what a third edition of this book for field instructors would look like, we knew that we had to include a justice-based lens to field education, because field is not separate from practice, it is practice. So on the one hand, our interns, our students, us as social work students at the time, we are there to learn from community members. We're also there to serve. So we are at a time with the pandemic, with coronavirus and social isolation and social distancing, trying to figure out how do we still do that while we're still trying to protect ourselves and our families and each other.
Yeah.
And it is a both and. It's a both and. It can't be an either or. It really is a both, holding both. And I think when we thought about writing this book for field instructors, it's really how, as field educators, we can hold both. And here we are in the middle of such a moment.
Well, yeah, it obviously, you know, we're in the midst of this crisis, and normally we think of crisis in individual terms, right? The person, the family dealing with a crisis situation and so on. But at the same time, we have to sort of look at this in a broader framework, right, of society. And part of the social work lens is as we're coping with this crisis, we have to understand that it's impacting different populations differently, and that we've always worked with the more vulnerable and often forgotten people, right? And that's an important thing to sort of remember at this time when, yes, we're worried about schools closing and we're worried about, various things, but also, there are some people who are at a disadvantage, who really are at much greater risk, right? And these are the people that I think our profession, tries to focus on the most.
And I think that when we, as a field education world, started to think about what this shift might look like in terms of social work education, I think there was a rightful hesitancy on all of our parts across the country for field educators to say we have to put a pause on field education, because it was going against the core of our values, the core of our code of ethics, which is to serve, which is to work with the people that need us the most. Yeah. And so it was hard to make a decision that is we're going to have to pull back on that. So I think, we saw a delay in people being able to say, hey, and now we're becoming, what's so amazing is that people are coming up with creative ideas about how to continue doing work remotely with our most vulnerable, as you say, populations. So I think you're seeing, there are questions. I think that also that field educators can use this opportunity to engage more in these critical dialogues. Like, for example, what is happening with folks who are incarcerated and in our prison system right now? Yeah. Is there testing? How quickly? What are the health resources? What about folks who are living in different living situations, right? What are the resources? How is testing? What's insurance and health insurance look like for communities? we've got to talk about racism. When we first heard coronavirus, the term coronavirus, immediately the one community that was negatively impacted was the Asian community and Chinese community. Immediately. That's a social justice issue.
Yeah.
That's an issue where we need to bring in conversations about race, racism, classism, right? And how if we continue in that path, then we're not really holding these ideals of what human rights and social justice and anti-oppression looks like.
So it's not just confined to these kinds of crisis situations. This is a part of everyday practice, you're saying.
It should be.
It should.
It really should be. I mean, I think our code of ethics say that, but I think that we just have a hard time talking about race and gender, and sexual orientation and ageism. We have a hard time. Nothing has really taught us how to do this. And so, you know, where do we start? Where do we even start to have authentic dialogue so that the dialogue and the critical dialogue for me and the trainings and work that I've done leads to action? So it's not until I understand my privilege, where I carry privilege, where I don't, where I'm really digging deep and doing a lot of that self-awareness work, can I then really be very active about changing those structures and systems?
Okay, yeah. So one of the notes that I wrote down in preparation for today's programs was, here's a pandemic and privilege. But I don't want to focus so much on the pandemic because, as you said, this is something that really is at the core of our practice and sort of understanding where our profession stands and how we create space, right? In order to have these challenging conversations about race, about privilege, about power, and so on. So, and thank you for mentioning the issue with the race and the Chinese Americans and so on, and Asians who are sort of being discriminated against and I mean, actually literally spat upon, according to some reports in the news media and so on. So as an educator, I mean, and how do field instructors approach this or should approach this? Because I know, in my own practice as a supervisor and teacher that, out there in an agency, I'll run into all kinds of expressions, right, of racism and discrimination and so on. And it's difficult because sometimes, yes, it's within our organizations, right, and it's hard to fight the power, right, the powers that be, supervisors who might have those kinds of, but also, there are clients who have these attitudes and so on. And as a service professional, is it my role, to sort of on an individual basis start that educational process and try to address these kinds of issues?
It is our role. I think that we can start with asking ourselves how we are feeling across all of our different identities. I think asking questions. Right now, many people have moved to online virtual field supervision. So, really starting with questions, I think, like, what does this pandemic mean for social work practice? For communities we serve, what does it mean? What are the justice issues we can raise right now in dialogue? What are those feelings of uncertainty, anger, frustration, fear, checking in with our students, weekly. How are you doing? Many of our students have had to leave campus, are now doing classes online remotely, are still trying to keep up with their workload in agencies and field agencies remotely, whether it's calling people on the phone. So maybe a student is calling someone and checking in on a community member that they've been working with. And then that community member is expressing lots of emotions, lots of feelings, fear, xenophobia, racism, classism. Then the field instructor can really sort of use the opportunity to talk about what came up, what happened, and really sit and listen and tune in.
Yeah.
And I think because we haven't learned how to do it, we're always afraid that we're going to say the wrong thing, do the wrong thing, not be politically correct. Language is so important. It's trying, putting ourselves in there and really saying, this matters, this is important to not only the field, but to how we engage sort of authentically with each other. And making it a space, I don't say safe space, brave space, if you will, that we can really sit in dialogue and then action. So, and then really asking students, like, what are the opportunities that we see now? Create more equity, if you will, for community members that we serve. What are the actionable steps right now that we can take?
Well, I guess before I ask you that very question, I just want to remind our viewers that we will reserve the last 10 minutes of the program for Q&A. So if you've got some questions, please write them into the group chat, and we'll have them passed along to us here on camera, and we'll be able to answer them as best as we can. So, so just a reminder about the Q&A. So Ovita, yeah. So what are the opportunities now? I mean, we're sitting here at this kind of inflection point, I think. It almost seems as if the world has stopped spinning, right? And once things come back online, literally and figuratively, I mean, what changes would you like to see in social work practice, in our education, and our ability to hold space for these kinds of conversations?
I don't think they stop because of what's happening right now.
Sure. Yeah.
I think that if anything, it does remind us of our core requirements, if you will, to the profession. It reminds us that justice issues don't just stop because, if anything, it is a social and economic justice issue right now. So in terms of what we can do, it's really staying connected, I think, with each other, really asking ourselves, how are our agencies responding? How are our community members responding? How we are responding to each other? Really looking at this as still very much a part of what social work is and what social work means.
All right. I see we've got some questions coming in already, so let me see if I can read it out for you. The first question is, why are we dividing social work students and, quote, the most vulnerable populations as two distinctly separated groups? Why aren't we recognizing that many students are poor, can't access healthcare, are facing unemployment, are disabled, have a history of criminal justice involvement, and or are clients of multiple agencies? Well, that's tremendous.
That's it.
Yeah.
That's it.
Yeah.
That is exactly 100% what the dialogue needs to be about. So I really appreciate that question because it really forces us to think about, again, language, how we're thinking, and where we're privileged.
So along those lines, if we're not separating ourselves, right, as either social work students or as professionals, I mean, how does that redefine our very relationship, right, with clients and to our work in general?
I don't know if it redefines. I think this is an important point. I think those multiple identities were real before the pandemic, and even more so glaringly now. Those are real. Our identities were always in the room, but were we really talking about and having an opportunity to share and describe that many of us might very well define very closely with community members that we work with, right? As a Afro-Caribbean cisgender woman, I'm identifying across many different communities. I don't leave anything at the door. When I come in, I'm all of it. The thing is, we don't talk about all of the multiple places that we really sit in who we are and how we might actually be very much connected with many of the systems that we also work in. So for me, it's always, I'm holding both. I'm not separating, I'm holding both.
Okay.
But the people around us might not be. So even in this conversation, there are feelings that we haven't. So that's something to acknowledge and put on the table.
So we bring all of these multiple identities to any encounter that we have, but we don't necessarily express them all, right? Is that the idea? I mean, we have to sort of be mindful and intentional when we tap into particular identities and use them as part of our work. And whether I'm working with someone who has come to my agency, or whether I'm working with somebody at my agency, the administrator or something like that.
Yeah, I mean, constantly. And it's constant. It is not, it's like unlearning all that we've learned.
Yeah.
Right. Yeah. Myself included. Every day I learn, I'm very conscious that there was something that I did or said and some impact that I had.
Yeah.
Right. And then if I don't know that, regardless of my intention, there was an impact. If I'm not fully aware and constantly thinking about that and really taking in feedback, like, oh, wow, there it is. I did that. Why? Where were my, what identity and where was I sitting in that I did not recognize or I wasn't aware? And that's the learning. That's like the constant learning. I always say it's like lifelong. It's really lifelong. And, it's a process.
Yeah. So in response to that question, right, it's important to recognize our privilege as social workers and so on, and to, again, not necessarily distinguish us from them, right? Us from vulnerable populations, and so on. So thank you for that.
Very important.
I have another question. Let's see if we have the option for students to work remotely. Is that Columbia's expectation, or do students have the option to not continue field placement? I'm not sure that this is the place to answer that.
Yeah, no, I'm just going to say right now, because this is day to day, right now, we have asked and sent a survey to all of our agencies to ask what is possible.
Okay.
What is possible? And field is suspended in terms of being in person in an agency or a program. However, we are asking for folks to really think about what remote kinds of assignments may look like.
Yeah.
And not alone, with the support of the advisor for the student, with the support of the field education department, we can help folks think about what remote assignments may look like. We actually just sent out an email to programs about different ideas, like 2 or 3 pages that we collected of various kinds of ideas according to the student's method area too. So if it's an advanced clinical student, a policy student, an AGPP student, that is information that can be used to sort of think about what for the next few weeks till May 8th, what is it that students can really do? And it's going to be different. It's going to be different. And we've already received lots of emails about, I'm not sure I can really have 21 hours worth of work for my student to do, but I definitely have these projects and assignments, or folks in agencies who've really had a whole list of things that students are able to still do, whether it's writing assessments or contacting people who are home right now, or doing some, agencies are still trying to do fundraising because they have to keep doing the work that they're doing.
Yeah.
So there are many different creative ideas to really think about. That's still social work. And I think that's the important piece.
Yeah. Let me see. A more general question. Any thoughts or ideas on how to support isolated social workers working remotely, alone, single-handedly supporting vulnerable and highly fearful people by phone or online? So,
yeah. I mean, we've got to build a community. It's very different. If we were in our offices, we can go to a colleague, we can go to a peer, knock on someone's door and said, I just had an interaction. I really want to talk. I really need to do this. And that's important. I actually found that in my study, like peer support is so important. If we could continue to build this community. So what I've seen this week happening, every week something new is happening, is that people are forming online support times during the week.
Okay.
So why don't we all meet at 12 o'clock on Wednesday as a team? This is beyond staff meeting. This is beyond, quote unquote, case conferencing. This is really peer support, and really getting that time together so that you can talk about what's coming up for you, what's coming up for you in doing this work in a very isolated way.
So this is something you're doing in your department right now?
Absolutely.
Yeah.
We are meeting online weekly. We also have Google Chat. In our Lion Mail is an opportunity to click on the camera. I'm not a tech person, but we've been able to chat every single day as if I were going next door to my colleague's office. I can quickly open up and chat and say, I just need to talk about something that's just happened, or what are you doing about this? And we're able to keep in communication with each other that way. And I had realized that, like, when we first started, I said, I'm going to miss my colleagues. We were able to share ideas with each other, problem solve with each other, talk about family and life. So we've got to keep that piece going. And I think the other thing that we've been doing a lot in our office is a lot of mindfulness practice. So before every meeting, really taking deep breaths. My colleague, Erika Echeverria, does amazing work around contemplative work. Really starting every meeting with that. So maybe now that we're in this social distancing, isolated community, it's really like, how can we, before we get onto the computer and start emailing, sit back, reflect, think, process, journal if we need to. Okay. And then stepping right into the day.
Yeah, which actually addresses one of the questions that was submitted. What are some self-care practices, right? Social workers, educators can practice during this period of isolation, and how do we channel that to our students and participants? And I know that I've been working with some students, and they're setting up these group chats and so on through Zoom with other students, with our student services and so on. So I think all of this is happening, and I think all of this is a wonderful experience. It may not be exactly what we wrote into the curriculum, but I think students are working with each other and really picking up very valuable skills, right? In terms of facilitating this kind of engagement and involvement, don't you think?
Well, absolutely. I mean, I remember, when I, as a social worker working in the DA's office many years ago during 9/11, we literally had to respond in a way that we never imagined. And I could look back on that experience and say, oh, that is how we responded in crisis, in our capacity as human beings, as community members, as individuals, as...
Okay, well, yeah, I mean, we're sort of, again, at a crucial moment, and I think we have to be purposeful, intentional, and we have to take notes so that, as you said, we can learn and move forward from these experiences. I have a few more questions, and I know that we're running short on time, but one of these is more of a suggestion. Could CSSW help compile a list or database of resources for clients that could be shared with field instructors, also including up-to-date information about what agencies are open and what are curtailed, what emergency funding resources may be available for clients, etc. As a field instructor, it would be helpful to pool together our resources and knowledge at this time. I think this is
absolutely.
Yeah. Can we?
I think, there are all these databases happening and emails, and so I think having it in one place is an excellent idea.
Okay, well, perhaps we can talk with your director and just see if there's something that
absolutely.
we can
just
organize.
Start something that we can then email out to our field educators.
And serve as that.
Thank you.
Yeah, and I know that that's something that our students are also interested in, as you might have seen that email from Desmond Patton, one of our associate deans, requesting proposals for micro grants, right? that could be used to fund projects, to provide services, and so on through our school. And I think in collaboration with students, with field education, with faculty here, this might be some kind of project that we could organize. So whoever wrote that in, thank you so much for the suggestion. I think we can definitely work on that. I'm
hearing some really exciting things from organizations and many organizations asking for folks to come and be a resource to community members.
Okay, well, I see that we're pretty much running out of time right now. So Ovita, thank you so much for joining us today on Social Impact Live, talking about field education, talking about the social work profession in general, and sort of thinking about where we've come from and where we need to go in the 21st century to make our practice really relevant to the populations that we not only serve, but also are a part of, right?
Absolutely, yeah. And I invite folks to really reach out to the Columbia University Field Education Department, our Columbia University Advising Department. We are here. We want to be able to be responsive to where people are right now and learn about different ideas and ways that people are thinking about practice. Thank you, Richard.
Well, thank you. And I know that there were so many more questions that had to do with field instruction and how students are getting hours and credits. And I know that's probably a question better addressed by and answered by someone, you know, a director in our administration.
Well, yeah, that is my, I think that, you know, I just want to acknowledge that if that the messaging that went out yesterday was not exactly what our conversation was going to be about today. And I tried to address as much as I can about those logistical pieces. But I think that we should have another one of these sessions soon to really be able to talk more about the logistical aspects. I really wanted to, I think our purpose was really to talk about how field instructors can support students in their continued learning. And the logistical piece is an important part of that.
Okay.
So to really be able to create space for that.
Yeah, so if it's possible, absolutely. We'll do our best here on Social Impact Live to arrange a follow-up program that addresses some of these more administrative issues. So thank you for that suggestion. I just want to let our viewers know that this program, you can view it again through the link on your original link through Facebook, but we'll also post a video recording of this program on YouTube, so you'll be able to watch it that way. This Thursday, we've got a special edition of Social Impact Live with Jennifer Borneman, who is with the U.S. Public Service. So she'll be talking more about the social work response to COVID-19. Next week, we've got Professor Mishura Akilova, lecturer here at the School of Social Work, to talk about the social work role with regard to refugees and also in response to the pandemic. So we've got a wonderful lineup of programming to come. But once again, thank you, Ovita, for joining us today.
Thanks, Richard.
Okay.
And everyone stay safe, healthy, and just with each other.
Okay, and on that note, I'll say goodbye. Thank you again for joining us today, and see you all next time. Bye-bye.